A very good afternoon. You're watching Lunchtime News on TV1. For the Newsfirst team, I'm Yuki Poshia. Let's start off with a look at your headlines for this afternoon.
Daily COVID-19 cases in Sri Lanka could rise to 6,000 if current mobility restrictions are maintained. A warning from an independent panel of health specialists. Explosive revelation made on the gas industry during the Mawata program. United States to administer COVID-19 booster shot for immunocompromised citizens.
An independent group of experts has projected Sri Lanka's daily number of COVID-19 cases could rise to 6,000 if mobility restrictions are maintained at current levels. Now, the report further projects daily deaths could reach 220 by early October.
According to the experts, Sri Lanka would breach the 30,000 death mark by January 2022. The expert group convened by WHO Sri Lanka includes 16 local representatives. The expert group also comprises WHO Director General's Special Envoy Dr. Palita Bekon, Consultant in Community Medicine Dr. Nihal Abesinghe, Public Health Specialist Dr. Vinya Aryaratna, Professor Asitha De Silva, President of the Association of Medical Specialists, Dr. Lakkumar Fernando, and President of the Sri Lanka Medical Association, Dr. Padma Gunaratna. Moreover, Professor Malik Piris, Professor Neelika Malavige, Professor Kamini Mendes, and Professor Manuj Veerasinghe have also contributed to the discussion. The experts noted with great concern the current surge in COVID-19, nearly overwhelming the capacity of the health systems to provide the required adequate care for the people. Bed occupancy rates at all levels of care facilities are over 85% and ICUs are over 90% and have increased progressively and is now in full capacity. The expert panel notes many areas of the country show a high PCR test positivity rate of over 20%. The report reveals as of 31st July 2021, more than 60% of sequenced samples are Delta variant. The experts opine for the vaccine that is used most widely, community vaccination will take 2 to 3 weeks after the second dose to provide adequate protection from severe disease and death. Based on the report, as of 9th August, less than 15% of the population had been fully vaccinated. The expert group has presented 6 recommendations to curtail the current situation, with the first being strictly enforcing movement restrictions, including inter-district travel except for essential services. The effective implementation of these measures may require the enforcement of a curfew for a short period in large geographic areas or nationally. The second recommendation is restricting or cancelling all public events for 3 weeks. Another recommendation is providing care and protect the health workers and augment staffing in hospitals to minimize disruption of essential health services. The expert group has also recommended developing and implementing an effective communication plan to engage the public and to update them on the control measures. Accurate reporting of both cases and deaths to get a better picture of the ground situation is another recommendation. Finally, the experts have recommended to prioritize the vaccination of all those over 60 years and those with comorbidities, preferably with Pfizer, Moderna or AstraZeneca, because a single dose of these vaccines provides some degree of protection until the second dose is given. Meanwhile, the Ministry of Health has decided to import oxygen due to the increase in the oxygen capacity of the COVID-19 patients. Meanwhile, the Ministry of Health has decided to import oxygen due to the increase in the oxygen requirement of COVID-19 patients. The ministry further added oxygen will be imported from Malaysia and India. The Ministry of Health stated steps have been taken to import 6 tanks containing 20 metric tons of oxygen during the first phase. So far, the oxygen requirement of the country has been met by 2 local manufacturers. Meanwhile, 156 COVID-related deaths were reported yesterday. According to the Department of Government Information, the Director General of Health Services has confirmed the deaths on the 11th of August. This brings the total COVID-19 death toll in the country to 5,620. According to the Deputy Director General, 34,345 beds in 224 centers are currently on standby to treat COVID-19 patients. He further added, as of now, 32,607 beds are occupied. The 24-hour vaccination drive operated by the Sri Lanka Army at the Vihara Mahadevi Park will be open to the public today as well. Meanwhile, the University of Sri Javadanapura has commenced a research into the retention and quality of antibodies in the bodies of people who have completed the vaccination process. Head of the Department of Allergy, Immunology and Cell Biology, Dr. Chandima Jeevandara said that the experiment commenced using people who had already received the full range of AstraZeneca and Sinopharm doses.
Taking a look back at your local news, a trade union action organized by station masters commenced from midnight last night. Now, due to the trade union action, railway operations were disrupted. The trade union action carried out by station masters was done citing that the railway employees infected with COVID-19 have not been provided with adequate welfare facilities. The president of the Sri Lanka Railway Stations Masters Association, Sumedha Somaratna, stated that the strike will continue till midnight tonight. Even though several trains arrived at the fort railway station, no trains that commenced the journey from the fort were in operation. Now, Newsfirst inquired from the General Manager of Railways, Dhammika Jai Sundara, regarding the strike launched by the station masters. He said he had held discussions with the Station Masters Association on these existing issues. The General Manager of the railway stated that the union did not respond positively to the proposals made at the meeting. Moving on, it has been decided to procure 15,000 metric tons of sugar stored at the Colombo port to Sathosa to be sold. Trade Minister Bandula Gunawardena stated that the stock of sugar stored at the Colombo port will be obtained today. The minister further stated that the sugar stocks have been shipped to the country before the importation of sugar was banned. Now, the money spent on the stock of sugar will be paid to the sugar importer and the stock will be obtained by Sathosa. Sathosa plans to sell a kilogram of white sugar at 101 rupees and a kilogram of brown sugar at 115 rupees. Now, what gave rise to the shortage of gas in the country? The Executive Director of the Consumer Affairs Authority, Thushan Gunawardena, elaborated on the matter during the Mawatha program aired last night.
Advertising and marketing expenses of Litro alone are 571 million rupees. Why should a company with a 75% stake in the market require 571 million for advertising? Amid all these unwanted costs, they want to pass it on to the consumer. Our opinion is, let us correct ourselves first and then request to hike the price based on reasonable grounds. If we are to raise the price of gas and milk powder, who will pay? We need to protect the consumer. It was revealed in Parliament that the salary of Litro's chairman is more than 2.5 million rupees. How can a person employed at a state institution be remunerated that much? Those should be evaded, and reasonable grounds must be presented for a price hike. They want us to intervene and burden the consumer. We need to protect both the consumer and the institution. We also have to ensure the government is not pressured.
ආයතනය ආරක්ෂා කරන රජයට බලපෑමක් වෙන්න තියෙන මේ පැත්තත් බලා ගන්න. රාජ්‍ය සමාගමක් විදියට ලිට්‍රෝ සමාගමට බැරිද පාරිභෝගික අධිකාරියට මීට වැඩි බලපෑමක් කරලා මේ වෙළඳපොළ ජනතාවට පීඩා නොවන විදියට හසුරුවා ගන්න. ඒක ඒගොල්ලොන්ගේ වගකීමක්.
That is their responsibility. The fact of the matter here is that is not being fulfilled. They spend funds in a wasteful manner and expect to hike prices through the Consumer Affairs Authority. The Consumer Affairs Authority is an independent institution, but I still have not seen how it is independent. The CAA should do more, but its hands are tied. Its autonomy has been lost. The organizational structure must be changed completely. This matter will not be resolved till then.
මේ ආයතනයේ තියෙන ව්‍යුහය හිම්පිටම වෙනස් කරන්න ඕන. කළා මේක ස්වාධීන කරන්න. මේක ස්වාධීන කරනකම් මේ ප්‍රශ්න විසඳෙන්නේ නැහැ.
Consumers continue to face hardships in purchasing gas cylinders today as well. Meanwhile, it was reported from the Malakaduwa area in Kurunagala that a Laughs gas customer had painted the yellow gas cylinder with blue paint and handed it over to the shop to get a new gas cylinder. Even though large queues of people were waiting to purchase gas cylinders in Malkaduava, only 60 of them were able to purchase a gas cylinder.
It has been 32 days since teachers and principals of the country have withdrawn from online teaching as part of a trade union action. Addressing a media briefing today, the Ceylon Teachers Union said the ministerial subcommittee appointed to solve these issues must provide a solution without any further delay.
The government has now appointed this ministerial subcommittee as a sole discretionary authority to provide a solution to the teachers and principals salary anomaly issue. There are serious concerns if this is the only authority to decide on this issue. It has been 32 days for our struggle. This subcommittee is supposed to provide a report about this on the 16th of this month, which is next Monday. However, yesterday the committee said they will meet every trade union before making a final decision. Minister G.L. Peiris, addressing a media briefing yesterday, complained that they cannot release the ordinary level examination results because the practicals of these aesthetic subjects are not completed. He pinned the blame of these delays on the trade union actions. These lapses will continue if they don't provide a solution for our issues. Therefore, we urge the authorities to push this ministerial subcommittee to find a solution without any further delay, and then discuss on that decision in the next cabinet sitting. Also, we believe that a time frame should be set to solve this issue. If not, these issues will just get worsened day by day. Then, to the parents, the only thing we have to say is that if the government failed to provide us a solution, our struggle will go on. If the struggle continues, the suffering of the children will also get worsened. Therefore, today we ask the parents to exert more pressure on the government and urge them to provide an immediate solution for the struggles of the teachers.
වළක්වන්න බෑ. ඒක නිසා අපි දෙමව්පියන්ට කියන්නේ ආණ්ඩුව පැත්තෙන් බලපෑමක් කරලා මේ කටයුතු කඩිනමින් ඉවර කරන ක්‍රියාමාර්ගයට යන්න කියන එක තමයි අපේ ඉල්ලීම.
The Archbishop of Colombo, His Eminence Malcolm Cardinal Ranjit, addressing a media briefing in Colombo today, stated that the letter sent to the President regarding the report of the Commission of Inquiry into the April 21st attacks and its future course of action has not received any positive response.
Our committee, which was set up to probe these April 21st attacks, sent a letter addressed to the President. In this letter, we stated that we are not satisfied on the manner in which these inquiries are conducted. Also, in this letter, we suggested that these inquiries should be conducted based on the facts released in the first volume of the report provided by the Presidential Commission, which probed into the April 21st attacks, and also on the revelations made by various members of Parliament. In this letter, we also mentioned certain facts that we received independently concerning these attacks. We directed this letter expecting a favourable response from the government and the President. However, on the 5th of this month, we received a 5-page response to our letter. The answer to our letter was provided by Attorney at Law Harigupta Rohana on behalf of the Presidential Secretariat. Attorney at Law Harigupta Rohana is the Director General of Legal in the Presidential Secretariat. After going through this letter, what we observed was that this letter does not provide answers to the concerns that we raised.
ඒ ලිපිය තුලින් අපි අහපු දෙයට පිළිතුරක් ලැබුණේ නැහැයි කියන එක තමයි අපිට කියන්නට තියෙන්නේ.